Tandem and in Ashburton and other places where they face health cuts.
Speaker, it is an absolute pleasure to talk about the health service review in New Zealand. The investment over the last year has come to a record high of $14.1 billion, and I must say that this health system has never been so better managed in the last year as ever before, and it is getting better and better. Compared to the regime under Labour, where over 9 years the budget went from $6 billion to $12 billion with no real increase in output, the last 4 years has been quite extraordinary in its success and should be celebrated. And Mr. Speaker, I want to tell you just for one moment about the Bay of Plenty District Health Board Financial Review, which I happened to look at a little paragraph about Te Kaha, a small, isolated, rural community on the East Coast. And there they reported that almost 100% of women were having cervical screening, almost 100% of women were covered for breast screening, and almost 100% of children aged 2 were fully immunised. Whereas 5 to 6 years ago, that would have been less than 60%, if not 50%. That record under National is something that should be celebrated. And one can then extrapolate it into the record of National right around New Zealand, whereas 4 or 5 years ago immunisation coverage was 67% under Labour. Now it is over 93% and going up. In terms of extra operations, 35,000 more electives done per year in New Zealand than 4 years ago. That's got to be celebrated. So when we hear Annette King having the gall to suggest that our health system is not well managed, she ought to look at herself very carefully in the mirror. She was the very lady who culled up to 30,000 patients off the waiting list and sent them back to their GPs to wallow. Today, as I said before, 35,000 extra electives per year than there were 4 years under that extremely inefficient regime. But, Mr. Speaker, I would like to point out that some of the new initiatives over the last year that have been shored in are incredibly important for sustaining the affordability of our health services in New Zealand. Because right around the world, sustaining health services has become problematic, particularly under the very, very difficult position after the financial economic crisis. The initiatives have included cementing in the National Health Board, which is a national purchasing agency to ensure that every health dollar counts. Secondly, Health Workforce New Zealand, and we heard Annette King saying that the Association of Salaried Medical Officers were querying the figures of Mr. Ryle and the Prime Minister. Well, the facts are they're only talking about hospital doctors, not about doctors in primary care. And we learn from the Ministry of Health that the greatest gains in health will come from health promotion, disease prevention, and the integration of primary and secondary care. That's where we need the new doctors, and that's where National has delivered 1,000 new doctors, 2,000 more nurses, and has reduced back office staff by 1,000. That's got to be pretty good. That's the fact of the matter, and I think Annette King has been very, very selective when she has used the figures of the Association of Salaried Medical Specialists.
Mr. Chair.
Honourable Joe Goodhue.
Mr. Chair, well, it gives me great pleasure and pride to rise to